as they usually are. All right, we're ready to rock and roll. So thank you everybody for joining our third Thursday Lunch and Learn. And just to remind everybody to keep yourselves on mute, and there will be time for questions and participation. Today, we are really excited to have one of our senior lead RNs and lead RNs in one of our health centers in Logansport, Indiana, joining us to lead today's session on hypertension. Jenny McCoy will be leading you through all of the pertinent and exciting, through the exciting world of hypertension. So we're excited for her to present, and thank you, Jenny.
Thank you, Reagan. Good afternoon, everyone, and thank you for joining us today as we discuss an ever important issue of hypertension. So I just wanted like to say before we get started that any information contained in this presentation is certainly not intended to substitute for any kind of medical advice. And we are here today simply to make sure that the awareness for hypertension, the risk factors, including managing hypertension and treating and preventing it. So let's start it. I'm going to start out with a quick question here. Which of the following statements is true? More than 100 million people in the United States have been diagnosed with or are currently being treated for high blood pressure. People with high blood pressure are 3 times more likely to suffer from heart disease. Approximately 1 in 5 people are not aware that they have high blood pressure. Or D, all of the above. So as you look through that, if you are thinking, yes, they all sound correct, you are absolutely right. All of these things are true statements. And when we talk about blood pressures, what exactly are we talking about? So the Webster's Dictionary defines blood pressure as pressure exerted by the blood upon the walls of the blood vessels, particularly the arteries. The pressure varies. It can vary due to the muscular ability of the heart, the volume and thickness of the blood, age of the individual, the health of the individual, and the state of the vascular walls. So what is the big deal about high blood pressure? Every time your heart beats, it pushes the blood through your entire body against the walls of your arteries as it is carried to every other organ in your body. And the more blood your heart pumps and the smaller your arteries are, then the higher that pressure is in the arteries. As most of you have had done, I'm sure you've had your blood pressure measured, kind of a breakdown of how it works behind the scenes, so to speak. Using the appropriate cuff size, it's wrapped around the upper arm, and using the bulb to put air into the cuff, it is tightened around the brachial artery in the upper arm, and that momentarily stops the blood flow. And then when that valve is released on the bulb and the air slowly comes out of the cuff, using a stethoscope, you're listening for 2 sounds: the start of the pulse of the brachial artery blood flowing back through there. And then the last sound you would hear would be the end of the recording of the blood pressure. So in order to interpret those results, as you know, blood pressures are written as 2 numbers. We have a top number and a bottom number. The top number is called systolic pressure, and it is caused or recorded when the heart is pushing blood out from the left ventricle to the body. So the heart is contracted, the left ventricle is contracted, and that's when we're listening for that systolic pressure, that top number. And the bottom number, also called diastolic pressure, is when the heart is relaxing and the blood is flowing, filling back up the ventricles. And if you ever, maybe you've heard this little easy way to remember the different pressures, what they're called. If you think of diastolic as down, you'll remember that's your lower number. So systolic over diastolic, and it's written as two numbers. And normally your readings should fall within the 120/80 range. So does blood pressure cuff size matter? True or false? Any old blood pressure cuff will do, as long as I'm checking my pressure and it's around what my doctor wants it to be, it doesn't matter. But when it comes to blood pressure measurements, one of the most important factors is often overlooked because the cuff size is wrong. So if the cuff is too large, you're going to have an abnormal low reading, which may be a mistake, inaccurate. And if the cuff is too small, then the reading is going to be too high, an error. So this statement is false, that any old blood pressure cuff will do. If you have a home blood pressure cuff that you're using on the arm, not the wrist specifically, but the arm, if it's too long or too wide, it would be a good idea to go and purchase a different sized cuff that fits your arm better and will give you a more accurate reading. Why is it important to have your blood pressure measured? Hypertension is also known as a silent killer because oftentimes it can be asymptomatic, which means it shows no symptoms at all. And unfortunately, often we don't know that we have hypertension until we have a complication of another kind. It could be something as severe as organ damage, in fact. So it is really important to know the numbers if your blood pressure is in a healthy range. And the normal range, like I said, is 120/80. And here's a chart I've included for blood pressure readings for adults. As you can see, the green is the normal, the 120/80 range. Below that, 90/60 would be considered hypotension because it's too low. And then pre-hypertension falls under 140/90, but above 120/80. And then as you can see, stage 1 and stage 2 hypertension. And when you get above, especially in stage 2, it does become a critical issue and is an emergency situation by all means. So it's important to remember that if you're diagnosed with high blood pressure, that you're monitoring your blood pressure either at home, at work, if there's somebody that can check it. There's blood pressure cuffs in almost every pharmacy to check your own blood pressures. It's very important to do so you understand or you know where your readings are. And maintaining an awareness of your numbers will help alert you to changes and detect patterns. And then you can take those recordings to your doctor visits and show those recorded readings to your doctor. If your numbers are off from what your medical professional's office may get when they have readings of your blood pressure, I would encourage you to take your blood pressure cuff from home to your visit so that you can compare the two readings and compare the cuff size to make sure that it is a consistent reading across the board. So some of the signs and symptoms of hypertension would include a severe headache, dizziness and blurred vision, angina, which is also called chest pain or heart palpitations, shortness of breath and difficulty breathing, fatigue or activity intolerance. So what kinds of things cause hypertension? Inactivity, sedentary lifestyle, sitting at your desk all day, lack of exercise, Alcohol and smoking are big contributors to hypertension. Genetics, your family history. Too much salt in your diet, too much stress in your life, being overweight. As a result of hypertension, several complications can occur. And over time, if it's left untreated, it can lead to a heart attack, stroke, organ failure, as well as some other complications, which would include hardening of the arteries, vision loss, fluid buildup in the lungs, erectile dysfunction, or memory loss. So in this little diagram, you can kind of see some of those complications that I just listed: retinopathy in the eye, heart attack, cardiomyopathy, also termed as heart failure, renal failure, elevated blood sugar levels, and even stroke, headache, convulsions, confusions. So we never want to take hypertension for granted. We never want to leave it untreated. And treatments in order to fight against hypertension would include lifestyle changes, adding exercise, cutting out your alcohol, limiting it for sure, decreasing your sodium intake. But some people, because it's a genetic concern or the risk factor is due to genetics, medication is necessary. And only your doctor can make that determination. So the best thing to do is to prevent hypertension so we don't have to treat it. So we want to always maintain a healthy weight, reduce our salt intake, get regular exercise, learn to manage our tension or stress, stop smoking. Like I said, limit alcohol, get enough sleep, and eat a well-balanced diet, which is high in calcium, potassium, and magnesium. So the American Heart Association has created a diet that they call the DASH diet, which stands for Dietary Approaches to Stop Hypertension. And it was developed to lower blood pressure without needing medication. And here are some of the foods that the DASH diet includes. So we want to make sure we're cutting back on empty carbs and adding proteins and heart-healthy fats. We want to make sure we're increasing our activity and our exercise. 30 minutes 3 times a week would be the minimum amount of exercise and activity that we want to recommend. Walking, jogging, running, aerobics, swimming, bicycling, anything, weightlifting, anything that's going to increase your heart rate, make your heart muscle stronger. So it doesn't matter, yoga, just anything that gets your heart rate up, makes your heart healthier. Some of the lifestyle modifications that can be made would be limit your alcohol, like I said, stop smoking, and decrease your sodium intake. So those 3 things are huge when you're trying to make your lifestyle modifications in addition to changing your eating habits and your exercising. So in a nutshell, that was hypertension and the importance, treatments, and ways to prevent it. Are there any questions or comments? If any questions or comments are come up after this is over, please email them or put them in chat to the virtual forum at wecaretlc.com. We thank you for joining today and have a good day.